question is about health care.
Yes, sir.
Trump care never got hit the ground running, and we'd like to hear what your
yes, sir.
policy would be on health care.
You know,
because we're one family away from a really big bill, one bad medical
yes, sir.
incident.
And look, our message to Pennsylvania families is that President Trump is going to have your back. And he did have Pennsylvania families back during the first Trump administration, because a lot of folks don't remember this. But President Trump inherited, and I'm talking about the private health care exchanges, those exchanges were in a bit of a death spiral, because the health care that was offered was so bad that people wouldn't sign up until they got very sick. And that's a terrible way to actually run a health insurance program. And that's what we were doing in this country. And Donald Trump implemented a number of reforms to make health care more stable in this country. And I'm not going to say that we fixed everything, because there's still a lot to do. But the guiding principle of Donald Trump's health care plan is, number one, we want people to be able to choose a health care plan that makes sense for their family. Number two, we want them to be able to choose a doctor and keep their doctor, not have their health insurance plan strip their doctor from them. And number three is we want transparency and the prices that people are paying. There's no service in the world where you go in and you have no idea what you're actually buying or how much you're actually buying it for. And we think that's one of the main reasons that the health care is broken. And by the way, this looks or presents very different problems depending on the issue that we're talking about. Okay, so let me give you an example. You go into a hospital, you have a young family, and I've heard this story so many times. The young family has a baby. And, you know, they're right at the moment where the woman needs pain medication. And then they choose an out-of-network provider, and they get home, they got a $20,000 surprise medical bill. We got to cut that crap out. We got to stop that. Make sure that people know what they're buying, know what they're paying for. That's really important. But then let me give you another illustration of this problem. You all would probably be shocked to know, or maybe you wouldn't, that Europe pays lower prices for drugs that were invented in this country than Americans do. Well, that's unfair, and that's ridiculous, and Donald Trump's going to change it. In fact, he fought to change it his first 4 years, and then Biden and Harris undid all of his important work. People don't give Trump enough credit for this, but towards the end of his administration, he really took on Big Pharma so that Americans would pay lower costs for prescription drugs. He wants Europeans, in the same way that Europeans have to pay more for their own defense, they've also got to pay a little bit more for their own health care and stop freeloading off the United States of America. That'll lower costs for Pennsylvanians, and that's an important thing we got to do too. Thank you, sir.